Welcome, athletes. Today we discuss 3 extremely common training injuries that are surprisingly easy to avoid with smarter habits. Many injuries happen not from bad luck, but from small technique mistakes repeated hundreds of times. The first common injury is shoulder pain, especially rotator cuff irritation from pressing exercises. A classic mistake is flaring the elbows too wide during pressing movements. This position narrows space in the shoulder joint and can pinch the rotator cuff tendons. Instead, keep elbows around 45 degrees from the torso. This small adjustment dramatically reduces stress on the shoulder joint. Also strengthen the rotator cuff with light resistance band exercises. A few minutes of activation before lifting prepares the joint for heavy loads. Use controlled tempo and avoid ego lifting with excessive weight. Remember, the shoulder sacrifices stability for mobility. When stability muscles are weak, irritation easily appears. Now let us discuss the second common injury. Lower back strain often comes from poor spinal positioning during lifts. The spine is strongest when kept in a neutral position. Before lifting, brace the core as if preparing for a punch. This increases intra-abdominal pressure and stabilizes the spine. Keep the bar close and hinge through the hips. Deadlifts are hip movements, not squats. Learning the hip hinge pattern prevents excessive spinal stress. Slow, controlled technique builds strength and protects tissues. Remember, the glutes and hamstrings should do most of the work. Recovery and mobility also help reduce strain risk. Our third injury involves the knees. Knee pain often appears when knees collapse inward during squats. This movement pattern is called knee valgus. Instead, keep knees tracking over the toes. Weak glutes are a common cause of knee collapse. The glutes help control femur alignment during squats. Single leg exercises improve knee stability significantly. Slow, controlled repetitions teach the body better movement patterns. Sometimes simply adjusting stance width helps knee tracking. Limited ankle mobility can also push knees into poor positions. Mobility upstream affects mechanics downstream. Think like a scientist and examine the entire movement chain. Warm-ups prepare joints, muscles, and the nervous system. Progressive loading is safer than jumping straight to maximal weights. Track your training loads and avoid sudden spikes. Recovery habits are equally important as training. Sleep supports tissue repair and nervous system recovery. Hydration helps maintain connective tissue health. Nutrition fuels muscle repair and adaptation. Mobility work maintains joint health over time. Injury prevention is not complicated. It simply requires awareness and patience. Small adjustments create massive long-term benefits. Strong technique is the athlete's best armor. Healthy movement patterns build resilient bodies. Remember, athletes, slow and steady progress wins the race. Train smart, protect your joints, and your strength will last for years. Preparation begins before the bar even leaves the rack. Warm-up sets teach the nervous system the correct movement pattern. Gradual activation protects muscles and connective tissue. Shoulder mobility maintains joint space during pressing. Healthy scapular movement supports shoulder mechanics. Small stability muscles often prevent major injuries. Retracting the shoulder blades stabilizes the pressing platform. Neutral spine distributes loads safely along the vertebrae. Breathing and bracing work together to protect the spine. The core acts like a natural weightlifting belt. Glute activation prepares powerful hip extension. These drills wake up the hip stabilizers. Hip control influences knee health significantly. Athletic control training improves joint resilience. Good coaching accelerates safe learning. Video feedback reveals technique mistakes quickly. Visual comparison helps athletes understand corrections. Balanced foot pressure improves squat stability. Think of the foot as a stable tripod. Core endurance protects the spine during long sessions. Consistency matters more than occasional extreme workouts. Strength grows best through progressive overload. Soft tissue care supports circulation and recovery. Tight hip flexors can disturb lifting mechanics. Smart athletes respect both effort and recovery. Tendons and ligaments adapt slower than muscles. Patience allows connective tissues to strengthen safely. Ignoring pain signals often leads to bigger injuries. Smart athletes adjust early instead of pushing through pain. Guidance prevents small mistakes from becoming habits. Tempo training improves motor control. Light technique days reinforce movement quality. Good mechanics extend beyond the gym. Daily habits influence injury risk too. Daily mobility keeps joints healthy. Even 5 minutes can maintain mobility. Recovery nutrition accelerates tissue repair. Protein provides amino acids for muscle recovery. Convenient nutrition helps maintain consistency. Quality sleep is the ultimate recovery tool. The nervous system also needs rest. Recovered athletes perform better and safer. Strong technique protects long-term progress. Shoulder irritation, back strain, and knee pain are common but preventable. Understanding mechanics dramatically lowers injury risk. Train with awareness and supportive teammates. Good movement builds durable strength. Think like a scientist and train like an athlete. Your body rewards patience and intelligent training. Slow and steady progress always wins the race.